Doctors Without Borders has warned that cholera cases in Yemen are increasing rapidly. In their recent report, the organization said the number of cases has risen to 63,000. This report has more.
Cholera cases in Yemen have surged to over 63,000 people, a 200% increase from the end of last April, according to Yemeni health authorities. The increase is particularly concerning for those who cannot access health care. 20 out of 22 Yemeni governorates are experiencing a significant rise in acute watery diarrhea cases, that reported as of May 31st. Doctors Without Borders has launched an urgent response in 8 Yemeni governorates to provide medical treatment, train staff, donate supplies, and carry out health awareness activities. The organization has opened a 60-bed diarrhea treatment center in Hajjah, near Abs General Hospital, which is the only place providing treatment for patients with acute watery diarrhea in this area. However, the disease poses a threat to patients with concomitant diseases and pregnant women who face increased risk of fatal death. The rainy season has also begun in many areas where support is provided, which could exacerbate the spread of the disease transmitted through contaminated water. Doctors Without Borders warns that many international organizations have limited resources, making the response insufficient. They are one of the few organizations providing treatment for patients suffering from acute watery diarrhea and cholera, which can kill within hours if left untreated. In cooperation with the health authorities in Aden, the organization runs the only cholera treatment center with 70 beds, which is operating at full capacity. The head of the Doctors Without Borders mission in Yemen emphasizes the importance of preventative measures such as safe drinking water, sanitation services, hygiene practices, and widespread health awareness to address the situation effectively. The organization faces challenges in finding and training personnel to continue patient treatment activities and addressing the lack of large-scale water and sanitation activities in affected governorates. Doctors Without Borders has treated over 10,000 patients in 13 governorates of Yemen during April and May, providing medical support to people living in risky conditions with limited access to health care. The organization operates 2 diarrhea treatment centers in Taiz governorate, one in Al Hawam suburb and the other is in Taiz Republican Hospital. It also opened a cholera treatment unit in Al Mafraq region and a cholera treatment center in Al Makha. In the Mar governorate, it runs acute watery diarrhea treatment centers at Al Wahda Hospital and a charity center in Al Dahi. In Al Hodeida governorate, to strengthen its response, the organization established oral irrigation points in both governorates. In Hajjah governorate, it opened a diarrhea treatment unit inside the general hospital and transferred activities to a school 5 minutes away. Doctors Without Borders also run a cholera treatment center in Atak in Shabwa governorate and in Marib governorate, providing supporting through oral irrigation points in health centers.